Good morning, folks. Thanks for joining us for our Wednesday town hall. We're having a little feedback, so Chuck is on it. It looks like, yeah. So hopefully that's gone. Well, he's still working on it, giving me instructions. Okay, so we'll work on that as we go. We're going to talk about testing today. And just want to highlight a few things. So testing is becoming more and more available, both to the greater Western New York community and to Canterbury Woods, both for our residents and hopefully our staff as well. And that's really started to open up within the last week. A lot of that is because the testing had been preliminarily done through the hospitals and Erie County Department of Health in anticipation of a huge hospital surge of patients there. And since that has started to really level off, which is a really wonderful and positive thing through effective social distancing and so on, and more tests have been able to be approved through the market, we're seeing the ability to ask for, and we're pushing to be able to gather our own testing. So I'm going to continue to update you about that, but I'm going to talk about some specifics today. So I'm going to give you some examples of what we're pushing for and been able to achieve with hospital systems relative to resident testing. This is both independent and health center residents. So it started Monday of this week. If an independent resident goes to the emergency room at any hospital, principally, we'd like you to go to Suburban because we have a close working relationship with them. But, if you don't want to go to Suburban, you go somewhere else. If you go to an emergency room and they treat you there, and even if they hold you a while, they're under something called observation, whereas they're not quite ready to discharge you back to Canterbury Woods. What we have agreed with them that they're going to do is they're going to test you while you're there. So you may be there sometimes up to 24 hours under observation. They will test you before they send you back to us. You will come back either to independent, back to your apartment if you can, or if for whatever reason you had an accident and you have to go to the health center, you will come back to either place. You will have been tested. We will be waiting for those results, and they're usually being turned around about a day and a half now. As we wait for those results, you'll be asked to quarantine if you're independent, and you will definitely be quarantined if you go into the health center. Chances are, even if those results come back as positive, we're going to want you to continue to quarantine for a period of time, independent or health center. For the simple fact is that even though you got a test on the day you were there, that doesn't necessarily mean that you weren't exposed that day, and the virus hasn't gained enough steam in your system to register on that test. So we are going to test you, we are going to have a baseline for when you come back, but if you're an independent, we are going to want you to quarantine for a period of time, and it may be up to 14 days. So you will hear directly from Dawn Wilkes each and every time a resident goes out to the hospital and comes back as to whether we want you to quarantine or not. I can tell you that we have one resident right now that's under quarantine, but we have, as of right now, we have no active cases at Canterbury Woods, or we've had no cases. So even though we have we actually have two residents under quarantine, one in the health center and one somewhere else. Neither of them have symptoms, but we're doing this and we're going to do it more often now for an abundance of caution, both for that resident and for the communities at large. And this is really going to become standard practice in most nursing homes and retirement communities going forward. So we're almost preparing ourselves for the new norm as we kind of work through the process here. For for residents who go to the hospital, go acute, and are admitted to the hospital. This is independent residents. If you're admitted to a hospital and you're there for a period of time, you will get tested soon before you are scheduled to be discharged back to Canterbury Woods, probably the day or 2 days before you'll get tested, and we will want those results before you come back. So if the tests are positive, you'll come back, either independent or into the health center. You will be quarantined. If the tests are negative, if the tests are negative, you'll come back. And you'll be quarantined. If the tests are positive, saying that you have been exposed or do have the virus while you're in a hospital, chances are you will not be coming back until those tests register as negative. Those negative tests will be through CDC regulations of, several tests in a period of time. And the simple reason for that, so if you're a resident, you go to the hospital, you're there for a period of time, you get tested, the tests come back as positive, meaning you've been exposed to or have the virus, we're going to work to have you stay at the hospital through that process. The simple reasoning for that is that we want to make sure that no viruses are brought back to the health center, are brought back to the community, if at all possible, transported back in. We're all hearing the horror stories of what's happening in long-term care. Majority of that is because viruses are brought into the community. So we would certainly, and hopefully you will agree with this, if you are positive for the virus and are showing symptoms, would rather you have at the hospital, because at this point, the ability is there, rather than bringing that back to the communities. Now this is the same for health center residents. So if residents are in the health center and they go to the emergency room, and the emergency room wants to send them back fairly quickly, they will get a test before they come back. They will be put under isolation. If the results are negative, that they weren't, that's great. The isolation won't be as strict. If it's positive, obviously, they'll go to strict isolation. If they are in the hospital for a period of time, if they're admitted, they will get a test, and we will wait until we get the results of that test before we decide whether or not we're going to bring this back. Now, this is a drastic change. It is actually the opposite of current Department of Health protocol and Department of Health guidelines. So current Department of Health guidelines say that hospitals are allowed and should be discharging residents back to nursing homes, even if they are positive for the virus, so that nursing homes can take care of that resident. We think that should change. We think it's going to change. Those regulations, those guidelines were put into place under the assumption that hospitals would be inundated with patients, would have overflow, and would have so many COVID patients that they just would have to continue to get as many people out of the hospitals as possible. Luckily, here in Western New York, that has abated a bit, and that's really not the case for hospitals right now. So we're actually pushing back, folks, on the Department of Health guidelines as we continue to work to keep the community safe, as we continue to work to keep individual residents safe, and certainly as we continue to keep the staff safe as well. So I know there's going to be a lot of questions on this. I will definitely cover it again on Friday, but I'm going to summarize quickly. If you're an independent resident and you go to the hospital for observation through the emergency room, you will get tested. You will come back to us. We will get the result of that test in a day or so. You will be asked to quarantine in your apartment, or you will definitely be quarantined in the health center, regardless if that test is positive or negative. We will have a baseline one way or another. If you are an independent resident and you go to the hospital and are admitted for a period of time, you will be tested. We will wait until we get the results of that test, positive or negative, and to decide whether to bring you back to the community. If that test is positive, chances are we will not bring you back to the community. We will wait until you are negative again. Health center, exactly the same thing. So one of the things I also want to encourage people not to do if they absolutely don't have to, and that is go out to a MASH or an urgent care center. I know that we use those as a community, and generally they provide a great service to the community, so I'm not disparaging them. They're very relevant, they're very much needed, and in general they provide a great service. But for our residents, going to an urgent care or a MASH exposes you just like you're going to an emergency room, and it's hard for us to track that. If you must go, then certainly go. I'm not saying absolutely you shouldn't go or do not go. I'm saying that, if you have an issue, please contact, or if you feel ill, please contact your primary care provider. Let him triage the situation. If he tells you to go to a MASH, then of course do that, or an urgent care. If he can see you, or he encourages you to do something else, then I would encourage you to do that. Just because, the level of exposure in a healthcare setting is certainly greater, and it's hard for us as a community to track those visits to MASH or urgent care. One more really main thing I want to talk about is something that bothers all of us and bothers me deeply as a long-term care professional. I've been doing this for about 28 years. I've been in long-term care and senior services, and it's always been running nursing homes, taking care of the elderly is a very politically charged field. People are very vulnerable. You have human beings taking care of human beings, and there's a lot of guilt involved in that from families and so on. So it's a very emotional, very difficult field to be in. But the mission of providing outstanding care to the elderly, for those of us that do it is, I can think of no better mission to fulfill. However, what we're seeing now is the villainization of nursing homes throughout the country. The fact is that nursing homes are really, and the residents that they serve are being affected desperately and dramatically by this virus. And you've heard me say it before, the tragedies that are out there, it's horrific. I will say this, that there's good nursing homes, there's good long-term care providers, and there's bad long-term care providers. There's good hospitals, and there's bad hospitals. There's great doctors, and there's bad doctors. We all know this. So I would encourage anyone not to lump in all nursing homes or long-term care providers are bad or are suspect as a result of some of the tragedies that you're seeing out there. And I firmly believe that even in the most tragic situations, the people that are running these nursing homes, certainly the staff, are working unbelievably hard and are unbelievably dedicated professionals taking care of the people that are the most vulnerable, that are the sickest, and they're putting themselves in harm's way to take care of our elderly. Hospitals and the doctors and all the folks that work in hospitals, the nurses, the support staff, they're being, there's a lot of hero worship going on with all of those folks, and deservedly so. They are true heroes. They are doing unbelievable work throughout the country in very trying, serious circumstances. So I'm not diminishing the unbelievably selfless acts of courage that are going on by hospital staff members across the country. They deserve it. They deserve all the praise they're getting. But I'm going to leave you with this. I'm going to say, what about our heroes? What about the doctors and the nurses and the support staff and the nurses' aides that are working in our skilled nursing, our long-term care setting each and every day? They're heroes too. They're putting themselves in harm's way. They're coming to work every single day dealing with patients just as sick, dealing with patients it's just as much trauma. And then they go home to their families and they have the same stories to tell. So please, who's ever watching this, don't forget our heroes as well, our doctors, our nurses, our support staff, who are working just as hard and deserve to be celebrated just as much as their peers working in hospitals. Thank you.